Welcome to the Mental Health Counseling Supervision Orientation for Plymouth State University Field Experience students. My name is Radiah Hall, and I will be leading you through a series of slides to describe our program's field experience, requirements, and also some information that may be helpful to you as a supervisor for our students. As an overview, first I'll be providing some basic information about the program, as well as the requirements for practicum and internship. Then I'll provide some basic information and considerations related to legal and ethical considerations for supervision, how to structure a supervision session, some goals and tasks related to supervision, and evaluation related to supervision. First, I'd like to provide an orientation to Plymouth State University's mental health counseling program. I am the coordinator of the practicum, Dr. Radiah Hall, and my contact information is here on this slide. You're welcome to contact me by email or phone anytime you have questions about our students. You'll see here the list of the core requirements for mental health counseling students. These are classes that are taken both by mental health and school counseling students across the counseling core, and includes what you see listed here on this slide. These are courses that the students you are working with will have completed prior to beginning their field experience. This next slide highlights the mental health specialization requirements, in addition to the core, that students coming to you for field experience will have had exposure to. There are a couple of classes here that students may still be completing during their field experience, such as critical issues and mental health practice, a course about crisis and trauma and substance abuse, or possibly they may also be finishing up psychopharmacology and the biological basis of mental health. But you can be assured that when students are beginning their fieldwork, they've completed the bulk of their coursework and are prepared to be beginning exploring how these concepts relate to the field. The practicum is the first field experience of length that students in the mental health program will engage in. They will have had a couple of pre-practicum experiences before this class. The practicum really is the place where they move from theory into practice. Our hope is that during the counseling practicum, they will gain a basic comfort in developing therapeutic relationships with their clients and have the opportunity to apply some of the things they've learned in the classroom to real clinical work. The practicum is a total of 100 hours, and 40 of those hours must be in direct service to clients. For example, direct service could include completing intakes, doing one-on-one counseling, co-facilitating or fully facilitating a group, or doing consultation with a parent for a client. Of their 100 hours, 80 of them need to be completed in a mental health setting, although most of our students complete their entire 100 hours at one site. For internship, students will move into internship when they've successfully completed the requirements of the practicum, including demonstrating through samples of their work that they've turned in for supervision that they've demonstrated a basic competency and ability to develop a therapeutic relationship and mastery over the basic counseling skills. When they move into internship, they will be completing 600 additional hours of field work, 240 of which need to be in direct service to clients. Typically, these 600 hours are spread over 2 terms, 300 hours each term. Some of the legal and ethical considerations related to supervision that you'll want to be aware of include informed consent. It's important that the supervisee understand a little bit about you and your credentials, and be able to know what to expect in the process and how they will be evaluated. You will find in the practicum or internship handbook a copy of the evaluation form that you'll be being asked to use to evaluate the student. We encourage you to review this early and have dialogue with your student about this evaluation form so that the two of you are both comfortable about the manner in which they will be evaluated. It's also important that clients working with students under supervision are aware that students are receiving supervision and that the confidentiality extends to the supervisor. This frees up students to be able to relax and consult with their supervisors and receive all of the support that they need at this early part in their training program. It's also important as you take on supervisees to remember the ethical and legal considerations related to vicarious liability. Since supervisees do not have professional licenses, their supervisors are responsible for them. Supervisees must obtain liability insurance. At the university, we set a deadline for students to obtain their liability insurance and request that they provide documentation that they have done so before they begin any of their direct service hours on site. You may also have additional requirements for the students to complete prior to beginning their hours at your site, such as background checks. And we encourage you to be in touch with them about these requirements early so that they can be prepared when the term begins to start as soon as possible. You may also wish to obtain your own liability insurance. It is recommended that supervisors continually check in with their supervisees to ensure adherence to legal and ethical guidelines. While students have been exposed to these as theoretical concepts, this opportunity for them to practice during their practicum and internship may put them across from situations that they are not sure how to handle. It's important to have conversations early and often with them about your availability and openness to consult with them and assure that they know how to interrupt you in the event that they are facing a situation where a client may be in danger of harming themselves or someone else, and that they feel comfortable knowing how to seek the appropriate supervision and assure that the client is receiving the best possible care. Some other considerations are related to dual roles. Just like we are mindful as counselors and working with our clients of avoiding dual roles whenever possible, this is also important within the context of clinical supervision, particularly because you will be in a position of providing evaluative feedback for this student. So avoiding possible social dual roles, professional dual roles where they would be working in different capacities with you, or therapeutic dual roles should be avoided. One question to consider when facing dual roles is, will this relationship affect my ability to remain objective? Evaluation is a very important part of supervision and maybe not the students or the supervisor's favorite part. It's very important that you review the evaluation form that you're going to use and make feedback a very normal part of your dialogue with the supervisee. We recommend that you provide both written and oral feedback during the time that you work with the student, and that the nature of your feedback is both formative and summative in nature. You may wish to take notes during supervision sessions, particularly if working with a student around a case that has particular legal or ethical considerations, so that you can document what action it is that you ask the supervisee to take, and to remind you to follow up on those actions. For the practicum and internship experiences, the university supervisor will be asking for a mid-experience and a final experience evaluation from your perspective, how the student is doing. The university supervisor will also be meeting with the student for supervision and reviewing samples of their work. A dialogue at the end of the term will be scheduled so that you and the other supervisor can meet with a student to talk about what you have noticed about their development over the course of your time together. When setting up your supervision sessions, I recommend considering the structure of your sessions and talking with your supervisee to assure that the expectations that you have about how your supervision time is spent are in alignment. early on during the supervision course, we ask students to come up with goals for supervision. I often ask them to consider specific goals that may be for the site, whereas other goals that may be specific for their university supervision. Logistically, you'll want to discuss the number and frequency of your sessions, making sure that you're meeting the requirement for fieldwork of an average of 1 hour a week of supervision. You'll want to talk to the supervisee about preparation requirements and what it is that you will expect them to have when they come to supervision. You'll want to discuss how sessions will be reviewed. For example, will you be live observing them? Will you be asking for verbal reports? Will you be asking for samples of their work taped to be turned into you? Your expectations related to professional behaviors should be reviewed, as well as the types of supervision interventions that you may be using. You should discuss with them consent and how you will obtain consent for audio and visual recordings from their clients, and the nature of your evaluation feedback. It's also important that you review with the student what experiences are required. You may wish to review the practicum handbook to see the types of things that we are hoping students will have the opportunity to experience while on site. And add to those any experiences that you feel are particularly important for a student to undergo during their fieldwork. We also recommend that early in the process, you review the emergency procedures for your site so that students know how to respond in the event that a client is in danger of being harmed or harming another. Here are some basic suggestions around structuring a supervision session. We invite you to request that your supervisees are prepared for supervision. For their supervision sessions with me on campus, I ask them to think ahead of questions that they want to discuss, and in some cases to cue recordings to be able to share parts where they had particular wonderings or confusion. We recommend at the beginning of the session identifying the supervisee's needs and some of their goals for the session. You may wish to attend to the supervisee's request by utilizing a supervision model, such as Bernard's discrimination model that we will review in the next slide. There may be managerial issues to attend to, for example, assuring accurate completion of their paperwork, reviewing system policies and procedures. Before closing the session, you may wish to review your session and identify goals for the next session and document progress whenever possible. We find that there are many possible things to attend to in supervision. Janine Bernard's 1979 discrimination model was initially created to support supervisors in recognizing if they have default roles or default areas of focus that they might tend to attend to in their work with supervisees, and thus support them in recognizing that there are other areas of focus and are other roles that could be taken on to maximally support supervisees. Across the top, you'll see 3 different roles that can be taken on in supervision. You might find yourself taking on a role of teacher when instructing a student on a new skill or technique, or when supporting them in understanding how a concept they've learned in the classroom translates into their work with clients. You may find yourself acting in a counselor role when the supervisee is processing things that are coming up for them as they find themselves facing work with clients, such as countertransference or blind spots. You may find yourself acting in a consultant role when offering supportive guidance to your supervisees, particularly as they move toward becoming more independent in their work and come to you with ideas specific to their work with clients and seeking to use you as a sounding board. Down the left column, you will notice 3 different areas of focus. We may focus on the intervention, that is, what the supervisee is doing with the client in session, such as to what extent is the supervisee reflecting feeling appropriately. You might focus on the conceptualization, that is, how the supervisee is conceptualizing the client issues, considering their ability to apply theory, working with them on their ability to take in all of the information from a clinical intake and support them in formulating goals for that particular client. Personalization issues are the ways in which the supervisee interacts with the clients and how their personhood may impact the therapeutic process, to what degree they are aware of how their own self and nonverbals may impact their clinical work. As you look across this model, you might notice that you have a default or preference areas that you tend to focus on in your work with students. Looking at the model may be helpful to you in considering how to intentionally attend to other elements. Or in your discussions with your supervisees, as you hear their goals, it might indicate to you a certain area where they have particular need at that time. For example, earlier on, developmental models suggest that more teaching may be helpful, whereas later on, you might find yourself more often in the role of a consultant. In a later version of this model, Bernard and Goodyear also address a fourth area of focus, and that is an area of professional behaviors and standards. You may find yourself attending to this area when considering how the student counselor models ethical behaviors in their interactions with their clients and their clients' family members, and also within the context of your agency. It is recommended that supervisors remain aware of supervisees' goals throughout supervision. As part of practicum and internship courses, students identify goals. To help facilitate these, supervisors are encouraged to review them and gauge their progress, structure supervision sessions with an overall awareness of the supervisee's goals, provide or recommend opportunities for the supervisee to achieve his or her goals, for example, additional trainings or readings, and also note the supervisee's progress toward these goals and document this in his or her evaluation. Evaluation is a critical component of supervision. Supervisors provide both informal and formal evaluations. 2 formal evaluations are included in the practicum and internship experience. The mid-experience evaluation, a university supervisor will be in contact with you in order to obtain feedback about how the supervisee is doing. The final evaluation, you will complete a formal evaluation about the supervisee, as will the university supervisor, who will schedule a meeting with you toward the end of the experience to discuss this evaluative feedback. It is highly recommended that supervisees be apprised of their progress throughout the experience to avoid gotcha moments. One of my things that I say to my students in my course is that I abide by no surprises at the end. So anytime I see or have concern about a student, or if I have concern about their ability to move forward in their fieldwork, I always have conversations with them early and often. I recommend that if you have any concerns or questions about students you're working with, that you do contact me or contact the university supervisor for that particular student as early as possible so that a remediation plan could be developed and support could be provided for the student to give them the maximum opportunity for remediation and success. It's very important that you maintain regular contact with the university supervisor who will be in contact with you to make sure that the student is progressing in a satisfactory way. This is a basic overview of some recommendations related to the practicum and internship. And if you have any additional questions, I invite you to contact me, Dr. Vidya Hall, or email me at the university. I'd be happy to hear from you, and I'm so thankful and grateful for the time that you dedicate to being of support and mentoring our students. Thank you very much.